assess the quality of service delivery by health information managers and measure their ethical compliance against the organizational culture of that particular institution. When I have two independent variables and one dependent variable, the data I obtained when I went through the ethics committee of the various teaching hospitals is that the number of staff of ABU teaching hospital is far lower than the number of staff of Aminu Kano teaching hospital. And despite the population, the number of patient attendance in ABU teaching hospital is more than that of Aminu Kano teaching hospital. Despite the kind of population, I start to analyze the statistics. Basically, maybe due to number of private hospitals in Kano, there are very many as well. And more, there are also more other hospitals being owned by the state government, Murtala, Abdullah Iwase, Asiyam Ayo, Ahmadiyya, this and that. There are plenty, and a lot of also private hospitals. A lot. Almost all the Congolese and all the Congolese is having a hospital in Kano. Ranging from the Ghana, this and that, and something. So I think they even assume that even the teaching hospital is just like a private hospital. I think last week they almost tripled the price of the cost, if not because of societal also. They even forgot that it's still a government hospital because maybe they think they can go to the royal access. So I used to wonder why is it that the teaching hospital there is having more staff and they have less patient attendance compared to Zaria, because Zaria is the only one. Even Kaduna, if not the Barodico and the Katsina and the environs, all rely on this particular hospital. And this is a very old hospital that have a very old patients. That unless if they die, those patients they keep on coming to this hospital. So I think something like a comparative analysis needs to be made and to find out why are we not also having more staff, and what should we do to also strategize? Because it's all about strategy. It's all about strategy. If you want to pool resources, if you want just about this issue of implementation of the electronic health records, I feel it's all about strategy. Why? Because when you look at the WHO building blocks of health systems, which is talking about medical supplies, human resource, healthcare, financing, and health information system is there. And now, the basic healthcare provision fund, which requires 1% of the consolidated revenue fund to be allocated to states through the various gateways of the primary healthcare board, NCDC, emergency, this and that, and of course the contributory healthcare schemes. They are meant to, activate the achievement of the health systems in order to ensure health system strengthening. I have info.
So if that money can also be strategized in such a way that it should be channeled towards the development of that health information system. When you talk about health information system, not just talking about cards and whatever, it's talking about also consideration. It's talking also it's also talking about computerization. So if we should strategize, but even at that primary healthcare level, you find out that those things are not used for the development of ICT per se, but rather maybe employment of health information personnel who will continue to write cards and whatnot. So it should be used in terms of digitization, in terms of ICT, supplies and other equipment that will improve the service and accelerate the achievement of the goals of the healthcare. That's one so as to get the universal coverage of health, the ultimate intention of the government. Even now, I think 2 weeks or so, another law has been signed, that is the Telecommunication Act. And this telecommunication law or act is any call you make now, per second, I think there is 1 naira to be deducted from the call you make. And that money will now be channeled towards providing care for 83 million vulnerable Nigerians. So that care provision, it means so many things on that farm. So if people can package their demands and make a strategic move in order to create those resources to be used for a particular development, I think that can be a welcome development. But actually, I think that is it. They are very, it's a center of command. They call themselves. It's a center of command. Even they have retainership section whereby they only deal with multinationals and maybe rich people or families that can invest money. They have that center of command. They link up with all those people, bring out projects, and they even into public partnership. They have, an independent private diagnostic center. That is Muhammad Sanusi Diagnostic Center, which is not only by the hospital. It's a public-private partnership. Apart from the private laboratories and what have you, which diagnostic centers the hospital have. And when you have those again, you have the staff of those companies, you also have the staff of the hospital again. So all these things, I think, accelerates the number of so you cannot build a wall without managing it with resources and equipment. And there are plenty of this that is not built by. Each time you enter, you will see magnificent structures, newly, and it is being done by individuals. There are a lot of lists of, requests that want to do this. Every mosque you see inside that place is built by a philanthropist. That was what inside they will come and say, I have like 20 million, I have like half a million, I want to tell this is what project can I do. That's how I got a new office and passion. Because somebody thinks that I have 30 million, what can I do? Can I do what? That one cannot be possible. It's not enough. But we have another thing, is school. We need some physical design, the office of the principal, the classroom, and some other facilities, and this and that. He said, but it's 30 million, and this one is cost at 40 million. But pay the 30 million, the hospital will organize. And that's how, and it has to be based on their own design. Based on their own design, it's not based on the philanthropist's design. I think is the strategy which makes them to have more personnel.
Thank you so much, sir. We really appreciate that. Round of applause. Because of the time, we are getting to the end of the program. Before we go, please, in just a sentence, sir, please, I believe you generate information, you generate data from your department. Is there any channel that will forward you to the management or please, sir, is there any, in just a sentence, sir? Okay. Nursing service department.
Yes, we generate information on a daily basis, and such information pass through the HOD, and the HOD in our own office is also presented at the TMC level.
Okay, thank you so much, sir. Please, at the lab, sir, I know they also generate information there. Is there a way whereby this information is being passed to
Well, as we round up, I'm glad. I just want to say this. I'm very happy that Professor Hassan is here. Well, this statement is not off record now. Record surely the lab. Without the record, the lab is not in existence. And from WHO website, you can get that about 70% of empirical data used in both diagnosis, management, and treatment of patients emanates from the lab. So it means we can't run away from it. But while I round up, I want to challenge the students still in here. I've been able to do a comparative analysis between AKTH and output because I started working from FMC Brennan. As of 2008, Dr. Hamad, that was the MD in FMC Brennan Kudu, had 720 nurses as of 2008. As I was doing my comparative analysis in output in 2013, output have less than 600 nurses. Now, then, in fact, you can't even complain the patient between FF people and Abbott. What I'm challenging the students is that some of us seated here, our uncles, our parents, our guardians, are the ones that actually can uplift the status of the hospital to what AKTH is today. Because if we don't, we'll continue to suffer together. That is just the truth. The government alone cannot do it. From my analysis too, I've been able to establish that the government alone cannot do it. AKTH and BUK, they stand out in Nigeria today not because of federal government, but because of what the Kano indigenes have been able to do to them. And until the Zaria indigenes decide to imbibe that, that's why I said this one is not off record. Nothing will change in Abbott. And I can tell you, if you choose to do it, it will change, because just a lady from Albani Science Academy, when we visited them, then I was the chairman of my association, and she asked me after my presentation, where will she do her BMLS? Because the listed universities does not have ABU. And I told her that the power that be doesn't want BMLS in ABU as at that time. But you can tell your parent to help us. The following week, the late Emir summoned the registrar of ABU, and today ABU have BMLS 400 level students. On that note, I rest my case.
Information, you can see information is power. Like you said, we all have a role to play as far as this is concerned. Thank you so much for the lecture, for the discussion. Today we've gained a lot. Like the school coordinator said, we are going to gain a lot of things we can't gain in the four walls of our class. And truly we've gained what we know we can't gain inside the four walls of our classes. All what we will say is we pray to Almighty Allah to continue to protect you and uplift you. We sincerely appreciate your time. We sincerely appreciate you to deem it fit to come and impart on us this beautiful and a wonderful knowledge. Thank you so much. We really appreciate it. A round of applause for them. Before, permit me to call on the principal post-basic nurses, Abodebele Teaching Hospital, just give us just his own contribution to the presentation and the discussion. But
other distinguished members of the high table, our dear students, good afternoon. I want to congratulate the Student Union government of this institution for this program that they have organized. Was it yesterday? I saw some of your girls in black walking in front of my office, and I had to stop them. I didn't even know I had an invitation to come here. And I was asking them, what is this black dresses for? And then they were telling me they had a health week program and they are doing some activity in the Barao Depot. So I said, but what is the implication of the black they are wearing? Because that is what attracts me. They said, well, they have just decided to choose black to cover up their dresses, from the outside environment. I said, okay. So this morning I saw your paper and I have to abandon everything to come here to be part of it. So much has been said from the presentation. I know health information, health record is a very important aspect of healthcare delivery in Nigeria. We need this data. And of course, because division of labor, whereby different people specialize in different aspects, in order to come together to make healthcare very efficient and be able to give the needed healthcare to our clients. That calls for the role of the health information managers in our healthcare system. because they are the ones that comes first contact with our clients when they come to the hospital, just like it was highlighted in the presentation. And when proper data are collected from these patients, it will go a long way to fasting and then make our treatment very easy in the hospital, the doctors, the nurses, the lab scientists, because you don't need to start asking, a lot of stories. Even just one aspect of the occupation of the patient, the occupation or the social background of the parent of the patient, with the child or the client is enough to assist us in taking a decision on what kind of line of management we are going to give our patient. We don't have to go around asking a lot of questions again. And like they are said, the electronic system of management has come to me. That is a very good one, because when all of us are carried along, that are partners in the healthcare delivery services, all I needed when the patient comes to me just to click on my system. All the information collected from the beginning is already there for me, and it is the decision, prescription, whatever I have to do. So your place in the healthcare system is very, very important. And I think I want to believe that you are even the most important group as far as the system is concerned. So please take your studies very seriously. Learn the ideal and please collect the right needed data from our clients each time you meet them. Because if you happen to collect the wrong information, it will assist the doctor and lead the doctor, the nurse, everybody into the wrong management of our clients. And that will be too bad. So we are counting on you, your generation, to please do a lot in order to save the life of our people in the country. Thank you very much.
Thank you so much, ma'am. Before the program will go, please, if you have questions based on the discussion and the presentation, please, we are going to take just a few questions. Question? Okay. Thank you so much. We'll move to the next agenda, which is the